Hello, everyone. I'm Dr. Andrew Glover. I'm a third-year periodontal resident at the University of Minnesota, and I'm recording this presentation in June of 2023. Today, I want to talk about something called the periodontal risk score. Now, I don't know if you're like me, but if you've ever worked with a patient who has some sort of periodontal disease, whether it's mild or maybe it's really severe, you might have struggled with trying to convey the severity of the disease and kind of the long-term consequences of having the disease for the patient. And ultimately, our goal, right, is to try to convince them or help them understand what type of treatment would be best for them to optimize their oral health. But sometimes it's really difficult to explain to patients. Well, relatively recently, I came across this tool called the periodontal risk score. I'm going to get into what it is, but I will tell you that it has changed the way I speak to patients and how I convey the disease to patients. And I found that it's an excellent motivating tool as well as an education tool for patients to change their behaviors and accept treatment. So I want to share this with you because it's been very influential for me, and hopefully it helps you in your practice. However, before we get into any sort of discussion about the periodontal risk score, I am a huge proponent of learning all the time, right? I'm a big book nerd, as I know many of us are at Rivertown Dental. So I just wanted to share 4 quick books that I've been reading, not related to dentistry, well, actually related to dentistry, but not related to the periodontal risk score or periodontics or anything like that. The first book over on the far left-hand side here, Training Camp by John Gordon, What the Best Do Better Than Everyone Else. This is an excellent book. It's a fiction fable book that's all about how do we achieve high performance and what are the characteristics of people who perform at a high level. I really liked it and gave me a lot of things to think about to optimize my life for high performance. The next book here, The Checklist Manifesto. This is a great book written by Atul Gawande. He's a general surgeon out on the East Coast, all about how checklists can help improve the outcomes of patients in the operating room and in hospitals and in intense care situations. There's a lot of corollaries directly to dentistry. I've actually taken some of his principles and applied them in my surgeries and in some of my practice, and I've really found that not only I do better, but my patients and my staff also do better as well. My favorite book out of all 4 of these right now is Treating People, Not Patients by Dr. Michael Sonic. Michael Sonic is a well-known periodontist. He's on the East Coast, and this book is absolutely fantastic, jam-packed with practical, really great, time-tested principles on how do you give a patient a 5-star experience. And it goes into a lot of details on how the office is created, what the ambiance is, how you interact with the patient, also how you approach the patient, how you talk with them about the treatments that you're providing, and your mentality and your attitude towards that. It's an absolutely amazing book because not only is it abstract and talking about some of the concepts from the hospitality industry, but it also goes into very granular detail towards the end of the book about what are the specific things they do to help patients. I found it highly practical and a very valuable book. And then finally, Zero Bone Loss Concepts by Thomas Linkachevitz. This book is amazing for dental implants, and specifically for clinicians who are either placing dental implants or restoring dental implants. It doesn't matter if you're doing one or you're doing both of them. This book has both of those concepts covered for you. I won't get into a lot of the details, but I'll say it's research-backed, very good pictures, good demonstrations, good illustrations. And I think if you're placing any dental implants or restoring them, this is a must-read for you to understand how do we make sure that we optimize the bone around our patients' implants. All right, so those are the 4 books I've been reading lately that I just wanted to share with you as just some inspiration if you're looking to up your game in any way, shape, or form. All right, let's get back into periodontal risk score, which again, I'm going to abbreviate PRS for this presentation. So we're talking about what is the PRS, we're talking about why we're going to use, or why I would recommend using the PRS, and then also just towards the end, how to use it. So before we get into that, right, let's just stop and think for a second. You've got a patient in your dental chair right now who has periodontal disease, okay? Or maybe envision you had a patient yesterday or last week in your chair who had periodontal disease. How did you describe the disease to your patient? What did you present as the reason for your perio treatment, right? You probably recommended SRP and maintenance and whatnot. What was the reason for that? Why did you tell them they needed to have that treatment, or that why you recommended that? Did you tell them that there were any alternatives to that treatment, or were there additional treatments that you maybe would have recommended as well? How do you describe the consequences of not treating the disease? Like, what do you tell the patient? If you don't go forward with this treatment, what's going to happen? I don't know about you, but for me, a couple of years ago, I kind of struggled to be able to answer a lot of those questions properly. But I will tell you that the PRS has changed the way that I approach each of these questions and has given me a good guideline to be able to talk to patients and answer a lot of these questions. So what is the PRS? Well, the actual literature source for it is right here on the right-hand side, translating clinical outcomes to patient value through the use of the periodontal risk score. The periodontal risk score is a prognostic system and a tool that was developed by Dr. Robert Levine and Dr. Preston D. Miller, or P.D. Miller. If you know anything about gingival recession, you probably heard about the Miller classification for recession. That's P.D. Miller. He came up with that. He's also come up with the periodontal risk score along with Dr. Robert Levine, who's over on the left-hand side here in the middle. Dr. Levine came to the University of Minnesota in February of 23 and gave us a really awesome day-long presentation about implants and also the periodontal risk score specifically. And then that's me on the right-hand side with one of my co-residents on the left. So Dr. Levine, just an amazing periodontist and a great human being. I have his cell phone number. I was actually hoping that he could be a part of our conversation about the periodontal risk score, but he had a couple other meetings he couldn't get to, so I wasn't able to bring him in on this. But just an amazing guy, and truly the idea of coming up with the periodontal risk score was developed to try to better educate patients on what are the long-term consequences of not treating periodontal disease and helping motivate patients to accept treatment. So the PRS, as I've kind of already mentioned, it's a prognostic system. Now, what do I mean by prognostic system? Prognostication or a prognostic system is simply trying to predict something in the future. When we talk about what is the prognosis of the disease, right? Is the disease going to get worse? Is it going to get better? That's kind of what we're talking about here. The PRS in particular, this system, this tool, it informs the patients of the 15 and 30 year perio prognosis. So just think about that for a second. 15 and 30 years from now. Have you thought about what you're going to be or where you're going to be 15 and 30 years from now? I know I sure haven't, right? It's very difficult for us to think about 15 and 30 years from now what we're going to be doing or where we're going to be. But this tool is strong enough to be able to tell patients whether or not they're going to lose teeth or what the chances of them losing teeth are due to periodontitis at 15 and 30 years, right? That's pretty impressive. And there's no other prognostic system on the face of the earth that even comes close to 15 or 30 years, being able to try to predict that. So what the PRS does is it estimates tooth loss, right, due to periodontitis, and it uses or creates that estimate based on the worst molar in the mouth, as well as the systemic factors from the patient. We'll see what those are specifically. We'll dive into that in just a second. One of the things I like is because since we only use one molar or the worst molar in the mouth, we're only using one tooth to make our periodontal risk score. So it's actually really simple to use, right? As long as we know what the worst molar in the mouth is, we can develop this periodontal risk score and then communicate it to our patients, which that's one thing I really like about it. It's easy to use. It's a great patient education tool as well. It highlights lifestyle changes that they can do to improve their prognosis, so things that they can do to make their prognosis better. It also helps motivate patients to accept and complete their treatment. And I think what I like about it as well is it empowers all team members to communicate with patients. So it doesn't take a dentist to figure this out, right? A dentist, a dental hygienist, an assistant, a treatment coordinator, we all can use this tool. It's simple to understand and communicate with patients, and we can all use this to motivate our patients and educate them. All right, so what is the PRS? So this is, if you read the paper that I had highlighted earlier, and I've sent it out to the leadership team, so they should be able to send this out to you as well. I highly encourage that you read it. In that paper, you're going to see this figure right here, which is the periodontal risk test, or used to be called the periodontal report card in some of the earlier versions of this. So let's just go through this briefly, and then we're going to step through each one of these panels in separate slides. So up here on the upper left, this is the different categories that we're going to be using to create our periodontal risk score. So you see here we have the date, so whatever today's date is, and then we have age, smoking, diabetes, molar type, probing depth, furcation, mobility. All of these categories are going to receive an individual score that will be added up for a total right here. That total score will then correlate to, on the upper right-hand side here, the score here on the left-hand side, 1 to 11. And each score corresponds to a percentage at the 15 and 30 year prognosis. We're going to get into all of this in just a second, just a high-level overview here. Each of these categories on the left-hand side, age, smoking, diabetes, etc., all of those scores, how you develop or how you find all those scores, are down here on this bottom panel. And we're going to go through that in a little bit more depth here as well. So that's just an overview of what the periodontal risk test is. So let's dive into the upper right-hand panel first. We talked about the score, right? Periodontal risk score. So every patient during every exam is going to get a score from 1 to 11. All right, so 1 being the best and 11 being the worst. Okay, and we'll talk next about how we develop this individual or this score for each patient. But on the left-hand side here, we have the score 1 to 11, and each score, let's take 6 for example, corresponds to 2 percentages: a percentage at 15 years and 30 years, which is 74% here. And these percentages pertain to the chances of not losing a tooth over 15 and 30 years. I'll say that again. If we have a periodontal risk score of 6, that means that we have a 90% chance of not losing a tooth to periodontitis over 15 years. At 30 years, we have a 74% chance of not losing a tooth to periodontitis. You could flip it the other way if you wanted to think about it from the kind of the positive way. You have a 10% chance of losing a tooth due to periodontitis at 15 years. And in this case, you have a score of 6, you have a 26% chance of losing a tooth due to periodontitis at the 30-year point. So it's, different ways of thinking about it, however you want to word it. But I like to think about it as a chance of not losing a tooth over 15 and 30 years. That's what these percentages mean. Now, one thing that's really unique about this type of prognostic system is that it doesn't necessarily use the words like excellent or good or guarded. Typically, when we're in dental school or hygiene school, right, we think about the prognosis of a tooth. We're typically taught to use words like it has a good prognosis or a fair prognosis or a questionable or a poor or a hopeless prognosis. Those words, they're helpful maybe to a dentist, right, speaking to another dentist, because we kind of understand what those words sort of mean, but a patient sure doesn't. And even between you and me, what you might consider excellent, I might consider good. But but what does good mean? Is good like questionable, or is good not as good as excellent? Or when you say questionable or poor, does that mean that the tooth has to come out? Or there's just a lot of ambiguity when it comes to using these words. That's why I like the periodontal risk score, because it assigns a percentage to it. I can understand a percentage, and more importantly, a patient can understand a percentage. They can understand a score. They don't quite understand excellent, good, and guarded, although they're here for us to kind of be able to relate that to a patient. But understanding what the percentage is for them for not losing a tooth due to periodontitis, that's very easy for them to understand. So when we think about using this as a patient education tool, we want to not only tell them the score, and ideally we want them to have a score of less than 5. If you read the paper, the score is ideal periodontal score is less than 5, so 1 to 4. And that kind of is they drew the line there because they think anything greater than 80% chance is an excellent prognosis at the 30-year mark. So that's kind of why they created that. So ideally, we want our patients to have a periodontal risk score of 5 or less. So that's how we understand and interpret the periodontal risk score and the 15 and 30-year prognosis. Now, I won't go into a lot of detail on how these percentages were created. All I will say is they've used thousands of patients over 30 years to create the best form-fitting models, if you will, for how many or what the chances are of losing teeth due to periodontitis. It's a fairly complex system that they've had to create, and a lot of research went into it. So I will say it's about the most accurate thing that we have, and we'll talk about that a little bit later. Okay, so we talked about what the periodontal risk score is. Let's talk about what the score actually comprises. Remember those categories we talked about at the beginning, right? We're going to look at the patient and categorize them across all of these different factors. So we'll start with our patient sitting in our chair. We're going to start with their age. How old are they? Are they 1 to 39? They get a score of 0 in that category. Or are they over 40? They get a score of 1. Next, we're going to ask about smoking. Are you a smoker or a non-smoker? If they're a non-smoker, they get 0. If they're a smoker, they have a PRS or a score of 4. Now, I want you to just take a moment here. Let's go back real quick and look at this slide. If they have a score of 4, right, that automatically almost puts them into the danger zone, right, where they're 5 or greater. And that's just because they're a smoker, right? So it's a really great way to be able to educate patients saying your risk for losing teeth is substantial just because you're smoking, right? And we know that smoking and diabetes are both risk factors for periodontitis. When we categorize non-smokers is simply anyone who hasn't smoked for over 3 months. Next, we look at diabetes because that's the other risk factor for periodontitis. So we want to know what their A1C level is, right? So what's your hemoglobin A1C level? Now, most of the time, patients don't know it, right? I don't know my A1C level, to be honest with you. So for patients who have periodontal disease, and if they don't know their A1C level, we give them a score of 2. Otherwise, if they know their score, then you simply assign if they know their A1C level, then we simply assign this score accordingly. Again, this is a very good motivating tool to help patients get to the hospital, get to their physician, and make sure that their diabetes is under control, because we know that there's a bidirectional relationship between periodontal disease and diabetes. It's so important to make sure that our patients who have periodontal disease have their diabetes levels checked and make sure it's under control. All right, so now we've kind of gone through the systemic factors that this risk score looks at. Now let's look at the molar type, and specifically looking at some more periodontal specific factors. So we're going to start by looking at the molar type. Now this is where we have to pay a little bit of attention and make sure we understand this concept. We are looking for the molar in the mouth that has the worst periodontal involvement. Now what do we mean by worst periodontal involvement? Well, typically that means the worst probing depth or the worst attachment loss. That's typically what we're looking at. So of all the molars in the mouth, which one has the deepest pockets? Or if you're charting clinical attachment levels, which I would hope that you are, which tooth has the worst clinical attachment loss? That would be the molar that I would select. Now we simply say, okay, which molar is that? Is it a mandibular molar? Then you get a score of 0. Is it a maxillary first molar? Then you get a score of 1. Is it a maxillary second molar? You get a score of 2. Okay, so we just have to figure out which molar category is the most periodontally involved. Once we know that, we've assigned that score, we then stay with that molar, that specific tooth, and then we go and ask, what is the probing depth, what is the furcation, and what is the mobility of that molar, right? We're not looking at what's the worst mobility in the mouth or what's the worst furcation in the mouth or the worst probing depth in the mouth. We're looking at what's the probing, the furcation, and the mobility for the worst molar in the mouth. And it's important that we note that, okay? Because we can easily be kind of misled by just always focusing on whatever the worst tooth is. But we know from the literature, from well, let's see, 40, 50 years of literature, we know that the tooth that is most likely to be lost due to periodontitis is, well, right here, this maxillary second molar. The second next tooth to be lost due to periodontitis, maxillary first molar. And then mandibular molars are after that. Okay, so that's why we kind of, or why they decided to use maxillary second first, and then the mandibular molars. Simply going down the probing depth, furcation, and mobility, look at what the probing depth is. Is it 5, 5 to 7, 7 to 10, or 10? Assign your score. Same with furcation. Furcation grade 1, 2, or 3. Grade 3 furcation is simply a through and through furcation. And then mobility, class 1, 2, or 3. That's how we assign those scores. So each one of those categories, again, gets a score. And then we put that score here. So age, smoking, diabetes, molar type, all the way down. And we're gonna add all of the scores up right here. And then that score that we have right here will be correlated to this upper right table, which you've already looked at. And we'll be able to fill in not only the 15-year prognosis, but also the 30-year prognosis right here at the bottom. So that is how you walk through and generate the periodontal risk score. And you're able to show your patient how every single factor plays into their risk score and their overall prognosis. You can show the patient if they're smoking. That's a huge contribution towards a poor perio prognosis. If their A1C level is out of control, that's a very large contributor to a poor prognosis. If they have deep probing depths, right, or if they have a furcation involvement, or if there's a lot of mobility, we can understand how the specific tooth level, or at the tooth level, how that relates to a poor prognosis. So why should we use this PRS, right? So, I mean, there's other prognostic systems out there like McGuire, Becker, Kwok, and Caton. Why should we use this in particular? Well, one thing from a prognostic perspective, it's the most accurate thing that we have. And I think that I mentioned that earlier. I think it was in April of 2023 in the Journal of Periodontology, a study came out that evaluated all the different prognostic systems that are in use today or that have kind of been published. And the PRS came out as being the most accurate. Now, is it 100% accurate? No, it's not. And so, if a patient tells you, is this 95%, is that a very strong number? I would say it's a strong number, but it's not a very strong number, right? There is always some variability there. But patients always, at least for me, they always ask, okay, doc, I know the tooth is bad. What are my chances of keeping this tooth? You can easily tell them you have a 25% chance of keeping all of your teeth, right? Or you have a 82% chance of not losing a tooth to periodontitis, right? You have the ability to use those numbers pretty reliably to be able to convey their perioprognosis. This helps patients understand the long-term prognosis. And we talked about this at the beginning, 15 and 30 years. Periodontal disease, it's a chronic disease. Whether they like it or not, they've got it and they're going to be stuck with it for the rest of their life. It's just like hypertension. It's just like diabetes. We don't cure it, we treat it, okay? And so it's important to help patients understand and start thinking long term instead of thinking the next day or the next month or the next year, which is what most patients honestly think about. It's what I think about probably too. I don't think 15 and 30 years out very often. This helps patients get into that mindset and helps them understand where we're coming from when we're recommending our treatment. We're recommending treatment to optimize their health for the long term. It also provides patients with actionable steps. That's one thing I like about the PRS compared to other prognostic systems or any other way to communicate about the disease. We can tell the patient, we can show them, if you stop smoking, you're going to greatly improve your periodontal risk score. If you get your diabetes under control, right? Or if we go forward with periodontal treatment that we're recommending, we're going to be able to reduce those pockets and improve your periodontal risk score. It also helps patients follow through with the treatment that we're recommending. And that can be in the office at Rivertown. It might also be involving a specialty office as well. And so making sure that patients understand how their actions will lead to an improved score, I think is very important. And then finally, a perio patient is a patient for life, right? And so as we treat these patients over time, the PRS can be used to show them their progress, which I think is very motivating for our patients. They love being able to see how the score went from an 8 to a 6 to a 5, right? Like they can see that improvement, and that really means a lot to them. The last thing here that I want to touch on in this slide is down in the bottom, the kind of the yellowish gold mustardy color here. Patients should never lose a tooth to periodontal disease if they follow the 5 keys to success. And I want that to sink in for a second, and I hope every one of us in the room right now embraces that patients should never lose a tooth to periodontal disease if they follow the keys to success. And I'm going to get to what those keys to success are on the next slide. But just remember, we know how to treat periodontal disease. We know how to help people keep from losing their teeth. Right now, you know how to do that. You have the ability to educate them and treat them. Let's not forget that we know how to do this. It's not just a simply, well, you have periodontal disease, so we got to take out the tooth and place an implant, or you have periodontal disease and it's hopeless, right? No, we actually know how to do this. We know how to keep people from losing their teeth if they follow the 5 keys to success. And if you read the paper that I mentioned or that I referenced earlier, the 5 keys to success are listed in the paper, and they are brush, floss, and clean teeth and tongue daily, complete recommended treatment, adhere to recommended maintenance schedule, so whether it's 3, 4, or 6 month recalls. Control your blood sugar, so get your diabetes under control, right? 6% or below, and quit smoking. Right? In my practice, I wish I had a business card, and I think I might print some out that just literally have these 5 things on. These are 5 things, like the 5 commandments of perio, that we should just be not only ingrained in our minds, but we should be telling our patients on a daily basis every time they come in. If you want to not lose your teeth, these are the things you have to do. It's that simple. If you follow these 5 things, you will not lose a tooth to periodontitis, or you have a very, very low likelihood of losing a tooth to periodontal disease. So a couple tips on using the periodontal risk score in your practice that I have found that helped me. We talked about the 15 and 30 year prognosis, right? Again, it's hard to think about 15 and 30 years, especially for our younger patients, but even for, patients who are busy and whatnot. A lot of times we're just trying to get through the day. You know what I'm saying? Like it's not easy to think about 15 and 30 years from now. So what I've found is helpful is to try to help the patient understand what might be going on in 15 or 30 years. What are those big life events that they want to make sure that they're optimized, right, for their health? maybe when you're retired, right? Or when they're going to be having grandchildren, or when you're in the peak of your career, or when your children get married, or things like that, right? Help them understand or think about, what does 15 to 30 years look like from now? Like when you're snowbirding down in Florida or Arizona, do you really want to have to be going to a periodontist and losing teeth, or do you want to be able to enjoy the food with your friends down in your casita in Arizona, right? Like, I have a patient that I actually said those exact words to, and I think it actually helped, right? So being able to relate to them about what is it going to look like in 15 to 30 years from now, helping them get into that mindset, because what we're doing now isn't just for the next year. It's not for the next 5 years. It's for the rest of their life. There's huge, long-lasting benefits to our treatment. I hope we believe that and hope we can express that to our patients. Another tip that I recommend is giving a copy to your patient, right? So make a copy of that periodontal risk score and write on it, right? Write the scores, but also write your recommendations, like follow up with your physician to get your diabetes checked, or recommend an Oral-B or a Sonicare toothbrush, right? As you write on it and mark it up and you give it to them, that just is another way to reinforce things you're talking about. They're going to remember that, and that's going to stick with them more than just giving them a piece of paper or a printout. Share the 5 keys of success with them. I've already mentioned it. I'll mention it again. Share those 5 keys of success every time they come in. Write it down. Give it to them. Make sure it's in writing so that they really have no excuse, and it's always just permeating their mind. And then finally, I would think the important thing using the PRS, right? We talked a little bit about if they follow through with the treatment, then the patient is going to be successful. As clinicians, we need to make sure we understand what are those treatment options, right? Of course, it's likely, comprehensive exam, scaling and root planing, perio maintenance, but there might be some other treatment options as well. Maybe we need to do a root amputation. Maybe there needs to be a guided tissue regeneration to try to rebuild some vertical bone loss. Maybe there needs to be an osseous resective surgery, or maybe some gingival grafting. As clinicians, we don't necessarily have to be able to do all of those, but we do need to make sure that we understand the variety and the entirety of treatment options for our patient, so that they understand what they need to do and what steps they need to take to improve and optimize their oral health. And so that's why I said here at the bottom, don't be afraid to call your periodontist if you have a complicated case and you're not sure what everything might need to be involved in a case like this. It doesn't mean you have to necessarily refer them. Maybe the patient doesn't want to be referred, or maybe it's not the right time for them to be referred right now. That's okay, but at least be able to educate your patient with the help of your periodontist, and by the way, I'm happy to help with that, to be able to educate your patient on what those steps might need to be in the future. All right, so that is the periodontal risk score. That is everything that I have. As we wrap up here, just another visual here of the periodontal risk score and the scorecard. Again, patients should never lose a tooth to periodontal disease if they follow the 5 keys to success. And I hope we embrace that, and I hope this tool is something that you can use to educate your patients on the disease, on the prognosis, on what factors are impacting their periodontal disease risk, and what they can do to optimize their oral health. Thank you very much, and please reach out if you have any questions. Always happy to chat, and I hope this is a helpful tool for you. Thank you.